Hello, I am Vishal Prabhukhanolkar. Let us talk about health economics. First, let us look at the definition of health economics. Health economics, as the name suggests, is a branch of economics which deals with the scarcity of health and healthcare systems. So now there are two parts to it. One is studying the existing health and healthcare system available in the country, in a nation or in the world, in the region. And the other part of it is find the factors which are influential in creating the health and healthcare systems in the particular region or nation or society. So now, for example, why people smoke? Because smoking directly impacts health, and since health is affected, healthcare systems also have to gear up to take care of this problem. So to make healthcare systems effective, it is imperative to study the habits of the people and find the source by which this habit gets started. Let us see what comes in the scope of health economics. There are three things which come in the scope of health economics. One, as I said, what influences the health and healthcare system both? Health of the people of a particular income group, health of a people in a particular society, health of a people in a particular culture, health of a people in particular industry, and so on and so forth, and healthcare systems in that particular industry, region, society, and so on and so forth. That is first part of it. Second, what is the health? What do you mean by health? And what is the value associated with it? For example, if I say I am healthy, or my society is healthy, or my region is healthy, or my nation is healthy, what exactly we mean by that? And also, what is the value associated with the health? So that constitutes the second part of it, second part of health economics. Third, health. To maintain health, we need healthcare systems. So what are the factors which influence the demand, and what are the factors which influence the supply of healthcare? That is a part which is also included in the health economics. Now there are 5 markets in which health economists operate. First is healthcare and financing markets. So for example, let us talk about a store which sells medicines. So that comes under this market. Also, the people who will finance this kind of store or this kind of supply chain to support that store will come under this market. So first is healthcare and financing market. Second is physicians and nurses. So now physicians and nurses also are studied by health economists for various reasons. Physicians and nurses are the last point of contact to the actual customer, which is a patient, and hence the study of them and the economic factors which influence them becomes very important. Third market which is considered by health economists is institutional services. So doctors and nurses or medical professionals or nurses on individual basis get in touch with patients and provide these services. At the same time, there are institutions which directly provide these services. So that market also is studied by health economists. The fourth market is input factors. Input factors are the factors which will impact the entire healthcare and health services market by merely being present. So the entire supply chain which is gearing towards providing these input factors, or the economic factors which lead to scarcity or availability of these factors, both these things are studied by the health economists under this. The fifth part is professional studies or professional education market allied to the healthcare industry. So there are many professionals which are being trained. So what influences a person to aspire to become a professional in healthcare industry? What factors affect the availability of this kind of education, and what factors match this demand and supply? This is the fifth part of the market which is studied by health economists. Now amongst all these markets, if we look at the individual services as well as the institutional services. So physician, nurses and institutional services, both these come under a separate term called medical economics. So medical economics makes a sub part of, or a very specialized part of, health economics.